interesting that the ACCC, well, certainly Rod Sims, he's not fussed, he's not fazed by taking on the giants. The issue here is app stores and how much of a duopoly essentially exists here.
Yeah, g'day, Tom. Look, it's interesting and good for him for continuing the good fight, dare I say, with the digital platforms inquiry. And once upon a time, we had more than 2 app stores. Remember, we once also had BlackBerry, and Microsoft had a crack at their own one for a little while. But now we're down to iOS and we're down to Google. And what he's really looking at is that lack of competition. So, for example, you've got people that make apps and put them on the App Store, but they also compete sometimes with the apps owned by Apple and Google. And so, of course, they rank their own apps at a higher level. They subsequently also take the metrics out of the other third-party apps and use them to enhance theirs. So there's a lot going on with this duopoly.
And also the charges, right, along the way, how much they clip the ticket for every either downloaded app or also, the charges within them.
Yeah, they clip the ticket big time. Like, we're talking 30%. And not only are they doing that, but they're also forcing app developers to use their own in-house payment system. So you can't even get around that. And of course, they're monetising that along the way. So they're not missing out on a thing.
Indeed. All right, that will be fascinating to see how that one plays out. Rod Sims and the government, they shaped up pretty well last time, so maybe they've figured out there are some bluffs out there. A big hospital hack in Australia, it raises the question as well, because they had to go to manual systems. How well prepared we are these days to go back to manual when there are these hacks, including in our health system?
Yeah, when we look at the attack surface and vector out there, healthcare is the #1 sector, not just in Australia, but globally, that get hit by criminals. And it's a no-brainer. Firstly, because of the criticality of a hospital, they're going to pay a ransomware really quickly because they want to get things happening again. And secondly, there's a whole lot of really sensitive and valuable patient data that they can sell on the dark web, use for identity theft or identity takeover, those types of things. So, hospitals, we saw in Victoria only a couple of months ago a good couple of dozen of their local area health network hospitals that got hacked with subsequent ransomware, and they were out of action for 5-6 weeks or so. So, it's a real wake-up call. I know we say that all the time, Tom, but this is yet another of the wake-up calls for the sector. They've just got to invest in IT security. That's what it comes down to.
And it's not cheap. Just finally, a NAB worker has been fired. This is a 2019 data breach. What's been found is this worker uploaded data to a third party. It's described as unauthorised. I'm just trying to read between the lines here. Do we know if this was deliberate or just a really bad error and one that's cost the IT worker their job?
I think it's a really bad error because they've uploaded it to a third-party site, which, from my reading of it, and this is what you love about Senate estimates, because all this sort of stuff comes out that you wouldn't ordinarily hear of with the bank heads appearing before the Senate now, is you've got a third-party website which they use, and they've accidentally uploaded, 13,000 records, which is, pretty damn serious.
It is. All right. Well, human error, we often hear. This time that human is gone from the company. I guess there have to be consequences. Nigel Phair, good to talk as ever. Thank you.
Thanks, Tom.